Hello, everybody. We are here. A smidge a little bit behind schedule, but you know what? Zoom is like that. It kind of determines how well things are going to work. Anyway, welcome to Mastering the Drop, a real view of recovery. And for those of you who are new here, we're talking about what it really looks like based on people that have truly walked the journey. And this month, we're actually talking about what alcohol, opiates, anxiety medications, caffeine, sugar, and the list could go on, what they are really creating in our systems that we didn't even know was tied to that, along with how the way you utilize them could become more dangerous than you would even think. Today, we have one of my favorite people on the planet, Rebecca LeMasters, and she's going to be bringing to light some very specific things that she knows in her professional life, like what opiate and stimulant use actually can do that nobody really tells you. So we're going to be talking about things like, that continuous feelings of pain, etc. So we're going to be moving into these things, and I don't know why I am having a frog, of course, as soon as I decide to hit live. So I'm going to take a sip of water.
We always, that's what I was saying before we jumped on here. I said we need one of those disclaimers that goes like we're having technical difficulties. But hey, we love things to be organic.
Yeah, right. We're coming. But I love, we were having this conversation a few weeks ago, and it's what actually prompted me to make this whole month about this. And because of our conversation and what we were talking about, and I believe I had mentioned, how long-term pain medication and opiate use really is causing people so much distress, right? Because, when we're utilizing opiate pain medication and we're starting to feel that what we know to be true as breakthrough, or what people believe to be breakthrough pain, and they're thinking to themselves, it's not working, I need more, my pain is getting worse, it's this, it's that, and I need more, that tolerance is building. But what they don't understand is that a lot of that has to do with the half-life, and that withdrawal period that starts to kick in mimics pain. So our brains are telling us, like, your pain is still there, when it's really just part of the natural process of the medication hitting its half-life, going through that, per dose withdrawal, whatever, decrease. I'm not really great at the scientific explanation thereof, but how that is going to show up. So if you hurt your back and you're taking it for back pain, as that half-life kicks in, and that weaning down process of, between dose, what's going to happen is you're going to feel the back pain, because opiate withdrawal is pain. This is why people, when they cross over into heroin, their withdrawal is like all over massive, humongous pain that people think is, super deadly. Like, that withdrawal actually isn't going to kill you as much as the alcohol withdrawal is going to kill you.
Yeah.
Or how dangerous, the withdrawal from benzodiazepines can be, but it is so painful. And so to me, I say, I think it's just baffling that we use something that causes so much pain in our body for pain management. But I'm not a medical professional. I just know that I always refuse, because I don't want something that's going to cause me even more pain, not to mention constipation and headache, which is what my side effects always are. Doesn't make any sense to me to cause myself any more pain in the name of decreasing pain. It just never made sense to me. But I know that there are a lot of people out there that do. And so I think, focusing on that pain for a few minutes is very, very noteworthy. So give us some of your infinite wisdom.
I think people forget about, and first of all, I just want to explain to everybody that I was gone and I do have luggage in the background and there are things that just weren't able to be cleaned up. So I apologize for that. Goodness, forgive me for being human. But anyway, I think that people forget about categorically how this medication is to treat the human body. You know, you're not a physician and you're not practicing. You don't think about it that way because you're on the other end of that pain. You're the patient, you're the client, you know. So there are specifics to why, you know, we are given those things. You're given a certain medication for tooth pain, for dental pain, for neck pain, back pain, hip pain, orthopedic pain, gut pain. You know, I mean, like there are so many different things, but there's a difference between your systems. You know, you have systems that people don't understand where these medications lie, hide out, and they do treat some of those systems better than the others. So, I mean, opiates, obviously, they can treat pain all over, you know, but originally these medications, and I mean, I'm not a physician either, but, you know, coming from education and a degree, these medications were meant for major disease and major all over body pain in people that already had degradation of their organs and systems, right? I mean, like cancer patients. So it was more about relieving the entire person. You know, I mean, if you're suffering from cancer and you're going to radiation, you have such, and I can be empathetic, but not sympathetic because I've not gone through something like that to that point. I did have that diagnosis and we did methotrexate. You know, there was never any pain medication that was attached to that. So I don't even know, you know, my doctor was like ibuprofen, Tylenol, and we're going to do the methotrexate to kill things off, not treat the pain.
Yeah.
So I think that people forget that's where we're coming from. You know, that's cart way before the horse. And so those medications are doing what they're supposed to be doing. You know, they're really digging in and treating deep rooted pains of different systems in the body. And so that's why different medications and alcohol and benzodiazepines and opiates are, you know, when we withdraw, it's different too. And there are different severities because those medications are for different severities. You know, so we kind of got to back it up and we have to attribute the withdrawal to the use. So if you're using an opiate for anxiety and, you know, for systemic, you know, smooth muscle pain, gut pain, things like that, that's not the purpose. So what it's going to do is it's going to hide out in your muscles and, you know, it's going to relieve those pains, but the long lasting effects are going to last in the systems that it's meant for, which are muscles, bone structure. And when you're no longer having the anxiety and you're no longer having the smooth muscle, whatever you're, you know, after you start to withdraw from that, obviously you're going to start to feel that in your arms, your legs, your feet. You're going to get a headache. You're not going to necessarily feel that, you know, in the other parts of your body because that's what that medication, you know, where it was supposed to hide out in the first place.
It's like a target, right? Like, so if we give a visualization, it's like a target and those heat sensing missiles, right?
Yeah, exactly.
It's like a heat sensing missile and it's going to go right to where it knows or what it was created for. It's going to seek that out and it's going to go there and it's going to reside there, even though you're going to be feeling relief in whatever area you opted to use it for. Because so many of us are like, I got a really bad headache. Hey, I've got a little bit of Norco left over there from yada yada or whatever. Let me just take that because the migraine is so bad, right? And I think, you know, what's super important to think about and understand here is we want to go into these things with eyes wide open, right? Eyes wide open. Like anybody that's still using or requesting opiate pain meds, you know, as a new introduction, right? Because I get it, you guys, there's people out there, long-term use, you know, I understand. I'm not trying to, you know, be your pain management, wean you off or anything like that. That's not what this is. But if you're going in for, say, a minor surgery, right? Go in with your eyes wide open, have that conversation with your providers, the surgeon, the anesthesiologist, the aftercare people, right? Like, hey, what will I truly need? And is there a way for me to not have more than just say that one dose before you discharge me to go home? And then can I go home with something that's more like a tramadol that's non-habit forming, or, you know, something else, anything else. And it, you know,
these are the questions of this culture that, you know, I don't think were necessarily talked about before, because we, you know, I mean, there's a totally different conversation. There's pharmaceuticals and there's the reasons why a lot of doctors use these medications, because one, you know, I mean, they know what they're for, obviously, you know, they know where the target points are, but there's a lot of monetary push behind all of this that, you know, you see in movies, they talk about in different podcasts. And I know we're not going to get into that, but there's those reasons too, from that side of the fence. But from the patient side, you know, you have to, let's just attribute it to childbirth. When you go in, my OB/GYN always told me, listen, if you choose to get, you know, an anesthetic when you're in delivery, that is going to, you probably will have more pain as it leaves your body, but it's going to take so much longer for that medication to leave every cell of your body, because you're also going through a major traumatic event where your body and your brain is trying to retain anything that's going to make you feel better. You know what I mean? Like you're not getting rid of. So it could have been, it's 6 months later, you know, after the, oh, I'm sorry. Are you still there?
Yeah, we're here.
I lost you. But I'm just saying, it's 6 months later after something, you know, like childbearing, and all of a sudden you start hurting, aching, paining, you know, I mean, there are things like that are happening that we're talking about to a lot of young mothers that are addicted right now, because this is how they became addicted, that now we're figuring out how long these things have lasted in our muscles, in our cells, in our bones. And a good conversation, like you're saying, with a physician can really take care of that, eyes wide open. But we have to really, we have to set people up for that conversation, because we're taught our entire lives that we're not as smart as the person treating us, you know, and
so much to say about that.
What's that? I'm sorry.
I have so much to say about that, because, you know, and sure, I'm in my 50s, whatever, I've been around for a minute, and I've had, you know, lifelong thing, but we have to be our own advocate. We can't be afraid. Now, I have noticed, you know, a lot of medical providers, they are being so much more cognizant and aware, and they're just not, you know, giving out a 30-day supply. You know, they're saying, here's a week, you know, here's a week, this is what you get. So I think that that's great. But if we get back to the, you know, the health issues, the long-term health issues, that once we allow that addiction to set in, and now we're in this recovery process, or let's say if you're somebody like me who firmly believes that I have the right and the ability to say I'm recovered, like there's still long-term ramifications to some of the things we put in our body, the alcohol, the benzodiazepines, you know, and different things, right? Like, I mean, I experimented with a lot of things in the 80s when I was a teenager. So, you know, there's that. But if we're if we're just talking about, like, you know, sure, my medical providers will tell me that, you know, my digestional issues are more autoimmune in nature, et cetera. as are a lot of my other, autoimmune inflammation type situations. But what I also notice is that the longer I recovered space, right? That different level of what goes in my body, I'm finding that I'm able to remove prescription medications without noticing a difference whatsoever, if not improvement from those situations. Because I believe that a lot of these chemicals, whatever they may be, they have those heat sensor target things. And even if you do have autoimmune type situations going in your body, that can shapeshift. Like that label doesn't have to be, stamped to your forehead just as much as being an alcoholic does. Like, sure, I was an alcoholic. I haven't been an active alcoholic in forever. And so I'm not going to, label myself with that. And the same with anxiety. Like I had generalized anxiety disorder with panic. I don't anymore. Right. And so but that's a personal preference. So for all of you out there that, need to think, feel, and be in a recovery process, that's your journey. That's for you. And my way is for me. But, when we look at those long-term effects, the difference in my teeth, the difference in my gut health, right? My digestional tract, some of it's age, some of it's abuse, some of it's, chronic health issues. But there is that piece that is from long-term alcohol use, long-term prescription medication use, right? As well as, I don't know, like I said, I was a teenager in the 80s. A lot of a teenager and young adult, teenager/young adult in the 80s, like, I don't know, like there were, the other things. And so some of those things that we introduce to our body don't necessarily just leave.
Right.
Like muscle has memory, right? So we're all made up of neurons and, I don't want to get into all the scientific names of all of our receptors.
But you're right. Like every piece and part of our body has a memory of what we once have done to it. I mean, we learn this in studying trauma all the time. When you tap into the memory of trauma, at times your body will feel things and you'll get anxious, your heart, your systems, your respiratory rate, your blood pressure goes up. I mean, so why are we thinking that a year after we've been in recovery, someone goes to a doctor or goes to anyone and says, I'm having a craving. I'm feeling the same way I did on day 7. And I'm on day 365. Can you explain this to me? I've heard a lot of people say it's not happening. It's mental. It's just something that triggered you. There's a trigger. This word trigger is, I understand there are triggers. It is a clinical word, but let's stop passing the buck to the trigger and let's get real and say, what did you do? Were you sick? What in your brain memory and your body memory maybe set that off? And it can be a traumatic event. It can be something that you are doing, but the trigger is not just mental, it's physical. It's a whole, it's a whole system of things. Or it is just your body being very mysterious and releasing something that all of a sudden you're like, oh my gosh, like I'm having this huge craving.
Oh, go ahead.
I was just going to say, you and I talked and I was driving one day and I told you, I was like, man, I honest to goodness, like can smell, taste and everything about a dirty martini right now. It was just like, it came back like, apple pie in the window smell, it was like, oh my gosh, like what am I going to do about this? And so the first thought I had, honest to goodness, was to go to the store and get blue cheese stuffed olives to suffice. I thought that would suffice. Do you know what I mean? I thought, well, maybe that'll suffice because that was part of the whole thing that I liked. But then I just chose to go home and walk and meditate instead, and it was gone. But it really did spark something in me, and we started to have that conversation because I'm like, how in the world how do I remember that smell, that taste, I remembered everything about that bar atmosphere, and it all of a sudden everything in me got excited, but I was mentally strong enough in my recovery to know how to dissect that and take care of it very quickly. If it would have been maybe a year into it, that could have been a whole different story. But now I can handle it.
I think it's, and I like what you're talking about here, because this is something like, just like going to your doctor before surgery and having that mindful conversation and being your own advocate about what my aftercare is going to be. The same has to go for recovery, right? There are things that we need to know and realize. And I'll tell you what, and I had a 30-year relationship with alcohol, and I have all the stories of, I could get 3 months, I can get 6 months. I was able to go 3 years, whatever, right? And then I thought I could, what's the phrase? Drink like a gentleman. I thought, I can, do this. And there was a significant period of my time where I was a very high functioning alcoholic. There was a lot of years where it was never more than 3 beers on a weekday, like Coors Light, right? Like whatever, like super low level, still alcoholic behavior, still a negative attachment, still an addiction, but not negatively impacting, right? And then that changed also, right? So we don't need to get into that. But what I think, was the pivotal piece of information and education that I received in my first 7 days, or maybe it was the first 10 days, whatever, was all you need to know about, or at least the way that my therapist described it, was she introduced post-acute withdrawal to me. And then when I got out of treatment, that was the first thing I was like, I'm studying this, what is this? And I had to dig for a lot of information on it. It was really quite disheartening, but I did manage to find 13 pieces of work on this, in, scholarly work on post-acute withdrawal, and was able to, smush it all down into a palatable one piece, for somebody in early recovery. And I clung to that because we go through these periods of feeling irritated, agitated, annoyed, having variable energy, mood swings, basically PMS on crack in early recovery. And it's scientifically proven to be a cycle, a naturally occurring cycle that we go through in early recovery. And it's a cycle that happens every 7 to 10 days in our body. However, we don't always notice it. And sometimes we wake up and it hits us like a Mack truck. But as long as I've been in the industry, I can say that whether my clients wanted to notice it or not, it was a huge contributing factor, if not the contributing factor, to every slip, horrible craving day. I got to sit on my hands, distract me. I got to go put my butt in a chair in a meeting and just sit there for 12-hour type day. Or again, a slip or a full-blown relapse or whatever. I've always been able to trail it back to a cycle of post-acute withdrawal. Now, that's not to say what you're saying isn't part of post-acute withdrawal, right? That memory system that we have embedded in our atoms, neurons, receptors, all of those things, that make up the way that we work, and because the systems they have memory. We can rewire it, but it takes time. Like right now, and all of my life, I've always had this desire and deep-seated need to to be the one that's in control of what my pain threshold looks like. Anyway, so I mean, I'm in that work right now. As something comes up for me in the state that I'm in right now, I will pause, whether you see me pausing or not, but I'm doing brain work to decrease like that pain scale. It's only a 10 if you say it's a 10, right? Now, okay, there's extenuating circumstances, right? Like if your femur, your tibia is broken in half, like yeah, that's a 10. I don't care who you are, right? But if two people stub their toe at the exact same velocity, why is it more painful to one and not the other, right? I say mindset. I've broken every single one of my toes at the same time. I tape them together and keep going.
Yeah. And I mean, that goes right back part of that, you know, patient and doctor client thing, predisposed to be not as smart as who's treating you and not be an advocate. When you see a picture on a wall of smiley faces, that one's frowning and then one's smiling, you know, from 1 to 10, all of these things came into effect the same time they started prescribing a lot of pain medications. Yeah. It was all about making the client,
what they call it pain.
Yeah, it was all about making the patient and the client happy. And really, honestly, it's about dumbing us down. You know, it's not something that they all sat in a boardroom and said, oh, let's just make everybody a little dumber about it. No, it's
not one size fits all.
That's right. It is. It's completely about, you know, dumbing the person down to say on a survey that this doctor in this hospital and this treatment was amazing. And that was what it came down to. But now, you know, there's so many people don't know that are on the patient side. We just have to keep encouraging people to research, you know, the post-acute withdrawal, because there is still not as much out there about it as should be.
Anybody
and
when you are
in, when you're in
I'll
early
send anybody
recovery, when you're in early recovery, those are the things that you need to learn about. And that's why it's so important. I go back to this. When I had this happen to me, like I reached out to you and I talked to you. I mean, you're a coach. This is what you do. I mean, ding, you know, I mean, I reached out to Pat Ochoa, you know, I called him right away. He's a coach. So these are the things he does, you know? And so I needed to understand it. With all the education and all the understanding I have, I still needed someone. So that's why I always say it's so good to have someone on your roster that you align with, that you can call. And it doesn't have to be necessarily a sponsor or someone that sits in that seat, someone that sits with you in your seat to health and wellness, you know, that has these answers. To get those instant gratifying answers also helps to appease that trigger or that, you know, that craving,
whatever you want to call it, right?
Yeah.
And, you know, I think that's, you know, something really beneficial, because we all have our things that we need our people for. I have my people that I reach out to. And so when I say I like to be able to say I've recovered, I don't mean that I don't need anybody. I'm like the bomb. I just mean that for me, like when I was on my recovery journey, right? I went to treatment, and when I came back out and I was having a conversation with, well, we'll just call it somebody that I'm, you know, formulating a no trust like factor, whatever, we're creating a relationship. I was having this conversation with her about how not everybody moves through the process the way that, you know, the mainstream does. I mean, we'll just put it that way. You know, not everybody has to go to detox. Not everybody has to do a 30-day stay in residential. Not everybody has to step down to an intensive outpatient, you know, type program where they have to, you know, go and physically be around the people, you know, 3-4 times a week. Not everybody needs traditional outpatient even. and not everybody needs the social supports of AA, NA, or, CODA. It's not a one size fits all. We get to add, edit, delete, make it our own. And so what I was, what we were conversing about, something that we aligned with, was that, giving ourselves that label that says every day I have to sit down in a chair and introduce myself as, hi, my name is, and I'm right. Like that's saying that's who I am, didn't sit well for us. And it just doesn't sit well for me.
Mm-hmm.
I'm a recovery lifestyle enthusiast, right? I'm an addiction specialist. I'm somebody that has walked and experienced every corner of addiction treatment that there is, along with addiction, like all the different levels of severity. I've had, all countless traumas and all these other things, but they don't define me. So when we come out of treatment and we want to adopt that label, that's fine if that suits you. But if it doesn't, I liken it to somebody that, once you're ADHD, you're always ADHD. Not true. I can attest to that. You're depressed. Once you're depressed, you're always depressed. Not true. I mean, unless maybe you just want to sit on medication for your whole life, but there are things that you can do to change it. You can change your brain. And I was watching a show. In fact, I'm going to drop it in here because I'm only in part 2, episode 2, whatever. And a client sent it to me, and it's quite fascinating, but very illustrating about how capable we really are at making up the way that we experience ourselves, our physical, our emotional selves, our everything. Like we truly get to control how things fire in our brain. Like we're just all these, atoms and molecules and everything, but we're also all exactly the same in that sense, right? Like our shells look different. Anyway, it's super fascinating, and I'm really enjoying it. So I'll make sure to share it here at some point in time.
Okay.
But we have to know that post-acute withdrawal is a real thing. It's just a proven thing. Whether our trusted advisors, and that's what I was saying. I do have my trusted advisors that I go to, depending upon what the situation is, right? Irritation, agitation, anger management, these things. But generally, I have a skill set that I utilize whenever I need a tune-up. But just sometimes I need it pointed out to me, or just a place to vent. We all do.
Yeah.
But I think so we've got post-acute withdrawal. We've got the natural occurrence of pain that happens in the half-life withdrawal period of medications. We've touched base a little bit on how our use of chemical substance, which we could bleed into a lot of other things as well, really can play a role in how well or unwell our digestional system works. Definitely it affects our organs, right? Our other organs, our liver, our pancreas. I had a bout of pancreatitis when I was about, I want to say 3 years clean. Just a random significant couple month bout of pancreatitis, never to return. Well, mostly because, when I feel like it may be coming on, or I might be having an episode, I know how to change my fuel, meaning my food, and what goes in my body to give it a rest, because I'm listening to my body. I'm honoring what it's telling me. But we also have things that people don't realize. Our teeth.
Yeah.
Right?
Yeah, our teeth, our gum health, that's why I always go back to systems. We really have to take it down to ground zero and start with the one cell that we started with, and then branch out into systems. That's why we're taught about those all through school. We're taught about those all through college. And then in life in general, as an adult, you stop talking about those things. You just know that it's great to brush your teeth and wash your face. And, you feel better when you're clean and you're hygienic. But there's a reason for that, because, our integumentary system is one of, our skin. And then our dental that starts our digestive system, is our teeth, our tongue, our saliva, and those are the things that really suffer when we take a lot of those medications, because again, those medications are built to treat one part, not to take care of the other. So, you're going to get the effect that you're mentally looking for. We're saying that's always going to be there. Your physician knows that. But
except until you get tolerance.
Yeah, there is a tolerance, because you have, but I mean, think about it. If you stack 50 bricks on top of one another, how much further does it get till you get to the top? It's going to topple over and then you're done. So, I mean, these are just things that we really have to start talking about. We have to start remembering that not every person is the same. Everyone's recovering differently. Everyone has different feelings, but we all can start at cell one. It's not square one, it's cell one, and work our way out.
I think just to deepen that, more, like people are, I hear people, I've heard people, I know people, right? When we're talking about our dental health, I actually experience, chagrin, which is dry eyes, dry mouth, dry sinus, narrowing passages of the sinus ways, right? I have to be paying attention to my teeth, and I'm not even in an active addiction.
Yeah.
Right. Because the more dry and dehydrated we are, right, then our gums, our bones, our skin, everything is not getting the proper amount of water or fluids or right. The same thing with, let's talk iced tea, because I don't know about you, but when I gave up alcohol, I went straight to drinking iced tea all day long.
Yeah, I used to drink a lot of iced tea.
Can't do coffee past, breakfast, past the morning cups. Like, I've never been an all day coffee drinker. Just never served me. I don't like it that much. But I was drinking tea all day. And as soon as I learned how much it was actually dehydrating my intestines, I was like, oh no, like, it's no different or better than the alcohol. Right. Yeah. And I didn't say it was worse than the alcohol, because that wouldn't be true. But when we're talking about, the difference between the dehydrating properties of alcohol, so's the caffeine. And so what do you see when you go into some of these meetings? Like, we need to be talking to our buds out there.
Yeah.
Because you go to meetings and it's caffeine. So amp me up, dehydrate my system. Smoke some more, have a bunch of sugar. Like, have you seen how much sugar that goes into an addict's cup of coffee?
Yeah.
And the treatment facility that I worked at, the residential one that was, detox, it was highly reintegration, but detox, a long-term residential program that I worked at, lovely program, and very much, like a social model where there was, a lot of, nonprofit. It was both. It was combined, because there was, health insurance and private clients, but there was also that element of, getting people back and reintegrated into society. And anyway, but with the budgetary constraints, but also just with back then, guidelines, the bucket of pink or red punch. What is that? Like, why do we give that to people in early recovery? Well, it's just a vat of sugar.
It's almost kind of the way that we have treated our school children, our school systems, like across the board, if we go back again to the way we dumb things down and discredit the person that we might be treating, and we don't do a full continuum of care, including nutrition. And I don't mean just a nutritionist sitting with you and looking at what you eat. I mean someone who dissects food. I apologize. It keeps pausing on me because I have a thing. I don't know why, because I had to on my phone.
Your name is flashing. Everybody knows how to spell it now. It's all good.
But I mean, it really, we have to do this a different way. We have to, this full continuum of care definitely will help us dissect, all of these things that we're talking about. It'll help the person on this side, which is us, figure out what their individualized care looks like. And it'll help people that are in the treatment setting see that maybe after someone, gets out of that, or even when they're still in there, that there are people that will spend individual time dissecting recovery as well as addiction. And that's what this all comes down to,
I love you for saying that. One, because I know, you, me, Pat, right? Like, we're super passionate about this. And Pat, you're getting all of the shameless plugs today.
I know.
Where's he at? Why didn't we invite him? I am so sorry. We'll just make sure it gets on his page also, because we're validating him. But it's it's what drives our purpose, right? Like, for me, it's the treatment transition to life space. Right? I left treatment and I said, sitting in the same chair over and over again every day for 30 years is not me. Like, I was not a stranger. AA is great. Don't get me wrong. Believe me, I was in and out of those rooms several times, but in my recovery process, that wasn't part of it. Always knew where there was one. Safer to belly up to than a bar. 100%. Love the people. Love the 12 steps. Love the, oh God, I'm going to draw blank. But anyway, love everything about it. But when I came out, it was, this is not it. I'm going home to the same house, the kids, the same bills, the same whatever, which of course there was nothing wrong in that for me.
Yeah.
My relationship with my family, there wasn't anything wrong, but I had to learn how to live differently in my environment. And I also had to learn how to allow people to experience me differently. And I had to lead by the examples so that they could experience me differently. I hope I said that in 3 different ways. That's a hard one. But so it was more about the now what's next for me. And of course, I did my journey my way, whatever, which was, bury my head in a book and learn absolutely everything there is to know about process, behavioral, and chemical addiction and treatment and the modalities and the methods. And then I went, oh, awesome. And I made this wonderful life process out of those evidence-based practices where we get to look at it happening in our life and go, okay, how do I need to restructure? How do I need to restructure? How do I need to restructure? And that's what I do with my clients every day, because it's such a big passion of mine that, the assertive continuum of care. Like, we all have to discharge at some point, but what are we discharging to? And is it right for the person? Anybody that's a clinician listening to me right now, please don't make your clients stumble upon me on their own. If you think somebody needs, like, hey, this is a wife, this is a mother, the relationship in the family unit is really strong, yet we need to restructure or recondition the way that the unit is functioning. You know what? Just connect me. If it's a match, it's a match. If it's not, it's not. No big deal, but don't make them find me on their own or go through trial and error and not get the help that they need. There's no competition. It's all collaboration.
Yeah, I think the culture has definitely changed to no competition, all collaboration. And we're definitely not, we're no longer dumbing down either side of the fence. And when I say that, I don't mean that in a derogatory manner, like in a first person. I mean the whole system. We started out talking about, why do we have pain? Why do we have all of these different effects that we go through in addiction years after we've started our recovery. There's a reason why, but you have to start learning that reason why day one, not
Right.
not day 722. And that's how you get into that's why you're successful in your recovery. And there are people out there like yourself, that will definitely go the extra mile to teach people about not only their lifestyle, but their systems and all their, different facets of health. And it really does calm you down. And once your brain is calm, the anxiety has lessened, then your ears are open and you too become a person of passion that then, to the next person, you are a gift. And that's just kind of how we have to kind of start thinking about this. And I mean, I think a lot of practitioners are thinking the same way because I've seen the culture change, and it's not driven by the beast of, writing a script and whose insurance is getting more money. And we're kind of keeping those conversations like for the people who need to have them. And we're just saying, look, we know that you're an individual and you have some really cuckoo stuff going on. So just let us help.
I think we are all shifting into let's walk with the client, guiding them in how they can understand themselves better.
Yeah. From
Right?
cell
Because,
one.
if it's this, yes, the skill sets might be the same across the board, but we all need to be teaching them how to interpret them as they apply or are applicable in their lives. And I think that we are really shifting that even from the, the detoxification level to the, the residential stay to, even intensive outpatient, those are a little more structured. They have their topics and et cetera. But I think you're right. I think on a clinical level, the clinicians, where we are all shifting in that sense of, hey, guess what? We can't tell everybody to do things exactly the same way and expect it to work for everybody. The same diet doesn't work for everybody. The same exercise or, exercise routine doesn't work the same for everybody. A portion isn't even the same for everybody. A proper dose isn't the same for, you know what I mean? I think that we're really going, oh, right? Like, that's why, when people ask me, it's not doing it my way. It's learning how to, it's learning it's taking the skills and learning how to apply them in your life. So when people say, like when I'm talking to, some of my network people, you got to get on that. You're never going to be able to scale, whatever that is. Like you don't scale addiction treatment, but whatever, it is what it is, right? Like everybody, some people are 30 days, some people are, 2 years hanging out with me, right? Because we haven't gone through all the firsts yet. I don't know, whatever. It's their journey, not mine, right? Like,
Yeah.
I don't know if we have
ultimately there has to be a teacher and there has to be a student. Right. I mean, there just has to be. Now, sometimes the student turns into the teacher, and that's success. That's my definition of success. When someone can do that in collaboration with, their educator and with their mentors. And that's what recovery is all about. And I mean, we talk a lot about the science of things because you and I are constantly researching and wanting to know why. We don't ever settle for we feel like crap today. Well, why do we feel that way today? And right. I think that's what we want everybody else to ask those questions. And I hope that through this, some people will reach out to you with some real Q&A. I mean, some hardcore questions and, get into what you're really doing, what your program's all about, and why you're so passionate about it and why you have such an intricate program, because we keep saying individual care, but individual is not just a word. It is an actual functioning program for each person. You know,
Yeah.
it is, your program is yours, but every person that you treat is getting the individualized care out of it. Even if they start, two people start the same program, it's flip-flopped and turned, you know, 5 different ways, because those two people are not going to be alike, you know. So, you know, the teacher and the student thing, it has to happen. It's just not happening enough. So I think that really takes us, you know, into a good segment of, you know, how do we continue that conversation, and how do we get people to start billing that way also.
So what I generally tell people is, you know, and I actually have notes. I was on a live a little bit ago, right? Is you have to be willing to contemplate, consider, or even dream about how you want to lead by example in your own life, right? And because we might be moms, we might be dads, we might be, you know, siblings or new wives or whatever we are, right? Like whatever unit we're existing in. We could just be, you know, we could be single and it just in a very business professional atmosphere. What, you know, what example do I want to lead by inside my unit? But, you know, really get intrigued by yourself, right? Get intrigued about getting to know all the little idiosyncrasies that make you you, because you are truly 100% a unique amoeba made up all of your own cells, right? And so if we go, you know, oh, I know something's amiss, right? Like I want to know why my gums are receding. I want to know, you know, like what am I doing? We control all of that. You know, like what am I doing, or what can I do to turn this around, shift it, change the momentum, whatever, whether it's our teeth, our skin, our habits, our addictions, whether they be process behavioral or chemical in nature. I don't care. Like you could be the biggest people pleasing codependent and I still want you to come because I know you're going to be able to use the skill sets as it would apply to you. But, you know, so we want to get to know our why. Why is are we sitting in this uncomfortable space just doing that comparison, that pressure filled comparison that just keeps beating us up by looking at all the people that you know we wish we could be like or whatever, right? Like I wish I was a normie. Well, you know what, let's talk about learning about what is sober conscious, what is sober curious, right? Like I'm down to start with you there if that's where you need to be, right? But know your why. Quit forcing very rigid goals onto yourself and thinking, I'm going to set this goal. Goals, think about a football game. You make it or you don't. You score or you don't. Like, if you're somebody that struggles with addiction, get rid of goals. Have aspirations that are bendable, flexible, pliable, movable in your own life so they can shape shift with you. And then, you know where you want to go. Right? So we want to watch comparison, but there's nothing wrong with having that celebrity crush or whatever, so long as you know why or what it is about that person, right? Like I look at that person and I wish I felt as polished, poised, calm, refined, whatever it is, right? Like you have to know what it is, not just you look at them and you're like, oh, they're beautiful. They're beautiful people. They can put on good clothes or whatever. And so I wish I could be them. No, that's not a why. That's not a why. That, you know, we have to know the true why. That we want that, because when we know where we want to go, and that was kind of a superficial one, right? But it might be, I just don't want to feel like a prisoner to every fad diet 4 times a year, the ups and downs of weight loss, pressures of, you know, of how terrible I feel when I don't make my 6 a.m. spin class. And how that really affects my body image and my body dysmorphia, and how it just sends me into a negative mental real loop spiral to, I wish I could drink like a normie, only I've been trying for 30 years to make that happen and it ain't working still. What do I need to do? Where do I want to go? Right? Like, so that's the only way that we can make an effective how you're going to get there plan. Right? And so that would be my big thing is, you know, what is it that intrigues you about yourself, even whether it's a good, bad, or indifferent? Like, what is it that intrigues you about yourself, and how much are you willing to get to know you?
Yeah, I think that's a good
around that
place
trauma, that bag. Even if you say, "Oh, I've healed
Yeah.
from all this trauma," if you're still carrying it around and it's not appropriately locked, packaged up, not even locked up, just wrapped in a bow, like, woo, that was a gift. That was a learning, right? It's up here on the shelf, just it's in a pretty little box now that I can look at and be grateful for, like all my traumatic events. And then the stuff you don't need to carry goes into the trash can. But if we're still carrying it around, we're not done. We're not done. We're still saying, you know what, I might want to languish or ruminate or wallow in this sometime, some other day. So I'm just gonna bring it along, right? Or that future trip and anxiety, like
that sounds like an excellent next segment.
yes.
Do not tote around the crap.
Well, and
set the bag down.
Right. And I think this is what July is going to be all about. And I'm saying it now because then this way I'm going to be held to not changing my mind on it because I think it's important. But July is going to be about all the ways that we do recover, right? If it's just unloading that bag, if it's, creating some sort of a screen or a veil that allows us to stay out of the future, tripping what if anxiety BS, or if it's how to put down or, remove that emotional attachment to something outside of ourselves, alcohol, opiates, whatever it might be. Remove that emotional attachment to that something outside of us to bring us peace, joy, comfort, relief, whatever, to allow us to feel valued and not dismissed or disposable, whatever it is that we're reaching for outside of us. Like, I want July to be all about how we can recover from like these very specific things. So I hope people start sending in little direct messages. Hey, can you touch on that? Hey, can you touch on that? Because we'll list them all out and we'll come back in and we'll talk about it. Anyway, I believe next week, Dr. Melissa is going to come back so that we can talk about effective ways to approach the removal of some of these medications, like more organic that we can choose and utilize. I believe that's the topic. I'm not sure 100%, but it, watch for the post beforehand. It'll definitely be there. I just don't have it up on my screen. I was having poor internet connection, so I just have to close everything. This lone window that's open. And always, I appreciate you being here. Make sure that you drop in the comments, Rebecca, the best way for anybody to reach you, because your outreach and connecting ability is so amazing. And I'm talking to people that might be struggling, that, you go, yeah, I was listening to Trisha, but I want to pick Rebecca's brain and see, like, does she, I feel like I might need a higher level of care, right? Whatever. Let me ask Rebecca what she thinks, whatever. And we're in totally different regions of the nation also. So depending upon where you're calling from, but anyway, make sure you drop it in there because I want everybody to be able to find you. I love it when you come. You bring so much magic, so much knowledge, so much very specific, research, elements to it, but also that personal level of knowing from walking it, but also working in it, and all of the things that you allow yourself to touch from a giving place. I don't want to say, I don't want to say that you donate your time all over the planet, but sometimes I want to say, hey, quit donating. And
I do a lot of nonprofit and donating, and I do that. I do definitely. I'll leave my information, and I hope to make some connections, and also just hope to be a resource and a light on the side of recovery. I know it's a tough lifestyle at times, but it does get better. It gets brilliant. It gets brighter. And it's just an amazing way to live. And you just don't know until you get there, but you got to start at cell one, and there. So
I love that. That's going to be the phrase of the rest for the rest of the week. Start it, sell one. Sell number one. Which one do you like the least? Let's work on that one.
that's right.
Anyway, thanks guys for being here. As always, the quickest way to reach me or the easiest way to get in touch with me to coordinate time with me is to just send me a text message at 805-710-2513. I will drop that into the comments as well. Or you can send me a DM, whatever you want. Sky's the limit. Mwah. Rebecca, you're amazing. I look forward to
Thank you.
hang out 1 second. I'm going to end the live and I will see you soon.